Prostate cancer, 8 signs that could save your life. Did you know that every year, thousands of men across the United States, and especially within the Latino community, walk around with a ticking time bomb inside their bodies without even realizing it? I'm talking about prostate cancer, a silent disease that too often gets diagnosed when it's already too late. My name is Dr. Daniela Ramirez, and after more than 15 years working in the healthcare field, I've seen cases that truly break your heart. Men who ignored the warning signs, men who said, "That won't happen to me." And when they finally walked into my office, the cancer was already advanced. Statistics are clear. 1 in 8 men will develop prostate cancer at some point in their lives. I'm not telling you this to scare you. I'm telling you so you can protect yourself. Because here's what most men don't know. When prostate cancer is detected early, the survival rate is over 98%. Yes, 98%. Almost every man who finds it early survives. So what's the real problem? Many men, especially in our culture, refuse to go see a doctor. "No, doctor, I'm fine. I don't have time. It's embarrassing. I feel healthy." And then they show up when the cancer has already spread to the bones, when treatment options are limited. That's why today, I'm going to share with you 8 warning signs your body may already be sending you. Not all of these mean you have cancer, but they do mean you should see a urologist as soon as possible. Before I share the symptoms, let me make something very clear. A lot of men think prostate cancer is only for old men, that if they're in their early 40s or mid-40s, they're safe. But that is not true. Yes, the risk increases after 50, but genetics, lifestyle, ethnicity, and even what you eat can also raise your risk. So even if you feel perfectly fine right now, I want you to pay attention for the next few minutes, because this may be the most important health information you hear all year. Let's start with the first warning sign: needing to urinate more often than usual, especially waking up multiple times during the night to pee. In medical terms, this is called nocturia. Now, of course, if you drink coffee all day or beer in the evening, it's normal to pee more. But here's what should concern you. If you used to go to the bathroom every 3 to 4 hours, and now you're going every hour or hour and a half without changing your fluid intake, that is a red flag. And nighttime is key. Most adults can sleep 6 to 8 hours without waking up to urinate. If you're waking up 2, 3, or 4 times every night, and this is happening regularly, that's not normal. It's not just because you had tea before bed. It could mean your prostate is enlarging and pressing against your urethra, the tube that carries urine out of your body. When the prostate grows, it prevents your bladder from fully emptying, making you feel the urge to pee constantly. Now, sometimes this is caused by benign prostate enlargement, what we call BPH, benign prostatic hyperplasia. But the only way to know for sure is to get checked. Don't ignore it. The second warning sign, and this is one that many men feel embarrassed to talk about, is pain during ejaculation. I know this is a sensitive topic, something most men won't even discuss with their partner, let alone with a doctor. But listen to me carefully. Pain during intimacy is not normal, period. This pain can feel like a sharp sting in the penis, a burning or shooting sensation in the testicles, or a deep ache in the pelvic area, lower abdomen, or even near the rectum. Sometimes it lasts just a few seconds, but other times it can linger for hours. The intensity varies. Some men tell me, "Dr. Ramirez, it's just a minor discomfort," while others come in saying they're avoiding sex altogether because the pain is unbearable. This usually happens because the prostate is inflamed, or, in more serious cases, because a tumor is pressing on the surrounding nerves. Yes, younger men can occasionally feel discomfort after long periods without sexual activity. That can be normal. But if you're older, especially over 45 or 50, and this pain happens often, do not ignore it. This is not something that goes away with a painkiller. The third warning sign is one you should never brush off: blood in your urine or blood in your semen. In medical terms, blood in the urine is called hematuria, and blood in the semen is called hematospermia. And I want you to take this seriously. Seeing blood where it should not be is always a reason to seek medical help. When a tumor begins growing inside the prostate, it can put pressure on tiny blood vessels and cause them to rupture, leading to bleeding. Sometimes the blood is very noticeable, turning urine red or brown, but other times it's so subtle that the urine looks slightly pink, or men don't notice it at all, especially in semen. Many men don't examine their semen closely, so they miss this sign completely. Yes, blood can also appear because of an infection, kidney stones, or inflammation, but you cannot assume that without seeing a doctor. You need proper tests, because if it is cancer and you ignore it, that tumor will continue growing, and the longer you wait, the harder the treatment becomes. The fourth warning sign is something many men ignore because they associate it with age, stress, or long work hours, but it can actually be a serious red flag: pain or discomfort when sitting. Imagine you're watching TV, sitting at your desk, driving your car, or just relaxing, and suddenly you feel a constant ache or pressure in the area between your testicles and your anus, called the perineum, or a dull, persistent pain in your lower back or pelvic region. And let me be clear, this isn't the typical muscle soreness you get after working out or sleeping wrong. This is a deep, nagging discomfort that doesn't go away with a hot shower, massage, stretching, or over-the-counter pain medication. This happens because when the prostate becomes enlarged, or when there is a tumor present, it pushes against surrounding muscles, nerves, and tissues. The prostate sits in a very crowded area of the body, so when something is wrong, sitting can become uncomfortable or even painful. Some men tell me they have to lean to one side when they sit, use a cushion, or avoid sitting altogether because the discomfort becomes too much. The most common type of prostate cancer, prostate adenocarcinoma, frequently causes this kind of pain. So if this is happening to you, don't just blame it on age, long work shifts, or normal men's aches. Your body might be trying to warn you that something is wrong. The fifth warning sign is one of the most serious because it often indicates that the cancer has already begun to spread beyond the prostate. Pain in the back, hips, or chest. When prostate cancer spreads, a process called metastasis, it very often travels to the bones first. It's not random. Prostate cancer cells tend to attach to the spine, hips, pelvis, and ribs, and once they settle there, they begin to grow. And the pain they cause is not normal back pain. It's not the type you get after lifting something heavy, sitting too long, or sleeping in the wrong position. This is a deep, constant, progressively worsening pain that does not improve with rest or common pain relievers. Some men say it comes and goes, but over time, it becomes more frequent and more intense. If you've had persistent back or bone pain for weeks or months that isn't improving, especially if you're also experiencing other symptoms on this list, please don't wait. Go see a doctor immediately, because once prostate cancer reaches the bones, treatment becomes significantly more complex. At that point, it's no longer just about removing the prostate. It may require radiation, chemotherapy, advanced hormonal treatment, or a combination of them, and the road becomes much harder. The sixth warning sign is swelling in your legs or feet. This happens when cancer cells spread to the lymphatic system, the network of vessels and lymph nodes responsible for draining fluid and fighting infection. When those lymph nodes become blocked, fluid begins to build up in the lower body, especially the legs and feet. This is not the mild swelling you get after standing all day. This swelling doesn't go away overnight. It stays there day and night. When you press your finger into the skin, it may leave a dent that takes a moment to rise again. Sometimes one leg swells more than the other. Yes, swelling can also be caused by other health conditions, heart problems, kidney issues, circulation disorders, which is exactly why you need to get checked. But if you have this swelling along with other symptoms on this list, it could be a sign that the cancer is progressing. The seventh warning sign is one that many people overlook because it can be confused with stress, aging, or lifestyle changes. But it is extremely concerning: unexplained weight loss and persistent fatigue. When prostate cancer reaches an advanced stage, it stops being a localized problem and begins to affect your entire metabolism. Cancer cells behave like thieves. They steal the nutrients and energy your body needs to function. So even if you haven't changed your diet, even if you're eating normally and not exercising more than usual, you may start losing weight without trying. And I'm not talking about 2 or 3 pounds. I mean noticeable weight loss where your clothes start fitting loosely. People begin asking if you're okay because you look thinner. And along with that weight loss comes overwhelming fatigue. You feel drained, weak, and exhausted all the time, physically, mentally, and emotionally. You wake up tired, you go to bed tired, and even simple daily tasks feel like too much. This symptom is especially alarming because it means the cancer may already be affecting the entire body, not just the prostate. If you are losing weight for no clear reason and you're constantly exhausted, please do not ignore it. See a doctor right away. And that brings us to the eighth and final warning sign, one of the most serious: numbness or weakness in your legs or arms. This occurs when prostate cancer spreads to the spine and begins pressing on the spinal cord. At this point, it's no longer just a prostate issue. It's a neurological emergency. The symptoms may start as tingling, numbness, weakness, or a pins and needles sensation in the legs or arms. Some men describe it as sudden electric shocks running down their back. And in severe cases, it can progress to losing control of your bladder or bowels. Many people don't understand what that means, but losing control of urination or stool is not just an embarrassing problem. It is a sign that the spinal nerves are being compressed and damaged. If you or someone you love begins experiencing any of these neurological symptoms, this is an emergency. You cannot wait for a regular appointment 2 weeks from now. You need to go to the ER immediately. The longer those nerves stay compressed, the higher the chance of permanent damage. Early intervention can prevent paralysis and preserve function, but timing is critical. Now that you know these 8 warning signs, I want to emphasize something extremely important. Not all of these symptoms automatically mean you have cancer. Many of them can be caused by benign conditions. However, you will never know the real cause unless you get checked. And this is where so many men make a life-threatening mistake. They assume it's probably nothing, and they wait for months, sometimes even years. And by the time they finally gather the courage to see a doctor, the cancer has already spread. Let me share a story I will never forget. A few years ago, a patient named Roberto came to see me, 62 years old, originally from Texas. A hard-working car salesman with a big heart and an even bigger smile. His wife practically dragged him into my office because she had noticed he was waking up 5 or 6 times a night to use the bathroom. Roberto told me, "Dr. Ramirez, it's just the coffee I drink." It's normal. I ran a PSA test, and his levels were extremely high. After additional exams, we discovered he had early-stage prostate cancer. Thankfully, because his wife insisted and didn't give up, we caught it early. He received treatment, had surgery, and today, 3 years later, he's healthy and enjoying life. But if his wife hadn't pushed him to go, that story could have ended very differently. Now let's talk about who is at higher risk. Age is the #1 risk factor. Once a man turns 50, the risk increases significantly, and after 65, it grows even more. This is why every man over the age of 50 should have a prostate exam every single year. Not every 5 years. Not when you feel something is wrong, but every year. Family history is another major factor. If your father had prostate cancer, your risk doubles. If your brother had it, your risk also increases. And here's something most people don't know. Genetic mutations like BRCA1 and BRCA2, the same ones linked to breast cancer, also increase a man's risk of developing prostate cancer. Another factor that often gets overlooked is weight. Being overweight or obese not only increases the chances of developing prostate cancer, but it also raises the likelihood that the cancer will be more aggressive and more likely to return after treatment. This is why your diet, physical activity, and maintaining a healthy weight are not just lifestyle choices. They are powerful tools to protect your life. I know what many men are thinking right now. But Dr. Ramirez, I'm embarrassed to go to a urologist. Or, the exams are uncomfortable. Or, I don't want anyone touching me down there. Trust me, I understand. No one is saying it's a fun appointment. But let me ask you a direct question, and answer it honestly. What's worse? A few minutes of discomfort, or months and years of chemotherapy, radiation, surgeries, pain, and your family watching you suffer? The answer is obvious. And to the women watching this, because I know many wives, daughters, partners, and family members look for this information on behalf of the men they love, let me give you some advice. You play a crucial role in protecting their health. Men can be incredibly stubborn when it comes to seeing a doctor. They avoid it, delay it, or find excuses. But many of them will go if a woman they love insists. Make the appointment for them. Go with them. Tell them how important they are to you. Tell them you want them healthy, that you want them around to see their children and grandchildren grow. Appeal to their heart, because I promise you, many men walk into my office only because the woman in their life pushed them, and later, they thank her for saving their life. I also want to clear up a common fear. Many men avoid prostate exams or treatment because they've heard that surgery can lead to incontinence or erectile dysfunction. And yes, those side effects can happen. But listen carefully. First, not every man experiences them. Second, medical technology has advanced dramatically. Today, we have minimally invasive procedures, robotic surgery, and nerve-sparing techniques that protect sexual function. Third, the earlier the cancer is detected, the less aggressive the treatment needs to be. And in some cases, surgery isn't even necessary. There are treatments such as radiation therapy, focal therapies, and active surveillance. But all of these options depend on early detection. You cannot choose a treatment if you don't know you're sick. So, what should you do if you recognized any of these warning signs in yourself? First, do not panic. Fear only delays action, and delays are dangerous. Second, schedule an appointment with a urologist as soon as possible. Yes, in the US, it can sometimes be difficult to get in with a specialist right away, especially if you're going through insurance or the VA system. If you are able to, see a private urologist. Your health is worth the investment. If you can't, be persistent. Call your clinic, request an urgent referral, speak with patient services, and tell them your symptoms. Do not let the system delay your care. Third, get a PSA test. It's a simple blood test that measures a protein produced by the prostate. If it's elevated, it could be a sign of a problem. Fourth, follow your doctor's recommendations. If they ask for additional imaging, do it. If they recommend a biopsy, don't postpone it because of fear or embarrassment. PSA levels can be normal even when cancer is present, which is why the digital rectal exam is also necessary, whether you like it or not. And starting today, take care of your prostate by taking care of your lifestyle. Eat more vegetables, especially tomatoes, which are rich in lycopene and help protect the prostate. Cut back on red meat. Exercise regularly. Maintain a healthy weight. And yes, keep a healthy sex life. Studies show that frequent ejaculation may reduce the risk of prostate cancer, so for once, you won't hear excuses. After more than 15 years in this field, I've seen both sides of the story. I've seen men who caught it early and are living full, joyful lives today. And I've seen families devastated because their loved one waited too long. I don't want you to be part of that second story. Prostate cancer is not a death sentence when detected early. But you must do your part. Pay attention to the signs, see a doctor, and get tested. Don't wait until you're in pain, because when the pain arrives, it's often late in the game. So please, if you are a man over 50, make a urology appointment this year. If you're under 50 but have a family history, don't wait. And if any of these symptoms sounded familiar, take action now. Your life matters. Your family needs you. Your children need you. Your grandchildren need you. Even the ones who aren't born yet. If this video helped you or opened your eyes, give it a like and share it with the men in your life. Your father, husband, brothers, uncles, and friends, because this information can save lives. Subscribe for more health content and check out my other videos on prostate health, prostate-friendly diets, and the tests every man should get. Remember, prevention and early detection are your strongest weapons. Don't let fear or embarrassment stop you from protecting your health. Your life is in your hands. Take care, and I'll see you in the next video.